Facing AIDS was a national theme that they chose this year for World AIDS Day. And the concept of facing AIDS is that right now, because AIDS is not in the headlines, it's not a visible manifestation in our community, like it had been in the early 80s, for instance, that people can ignore it pretty easily because it's not something that is so obvious. And so, as a community, we need to continue to look at it and to continue to address the concerns and the needs of HIV because right now we're at this pivotal point where things can change rapidly, but there needs to be support. The community needs to let our legislators and our politicians know that we still are behind this and that we would like to see it eradicated in our lifetime. We are doing free testing today. People can come into our office between 1 and 6 and get a free HIV test. And we do that regularly in our office 3 days a week and in the community also. When we do assessments, we recognize that a lot of people already understand how the disease is transmitted and how to prevent it, but there's not a lot of efficacy going on. So support is really an essential part of that component as well. Young people need to have support systems that encourage healthy behavior. And so part of the curriculum in that education needs to be how to develop and support networks. Diseases like HIV and many others affect people who are a lower economic class and people who are in poverty. Also people who suffer from cofactors such as homelessness, substance use, and mental illness are much more greatly affected. Michigan as a whole sees about 1,000 new infections a year. We see about 300 cases come through our doors who need support, and we probably test close to 1,000 people every year and do counseling for that many people to talk about risk reduction. So we see that many people who are at risk. I also look at facing AIDS as a way that people can represent themselves and represent the community and show support for people who have HIV, and people can see that. It's tangible.